Hello, everybody. I'm Sasha Bogosian. Thank you very much for joining another session in Revive's Summit Series. I am Chief Strategy and Innovation Officer at Revive, and for those of you who I've not had the pleasure of working with, the time that we spend together in these sessions reflects what Revive does in the industry, which is work predominantly with health systems to help them solve challenging issues. And as you know, there are no shortage of challenges in our industry, and which is what makes the Summit Series really fun. We get to talk about all these challenges, and we're joined by guests and leaders who are not just commenting on these challenges, but they're out there trying to solve these challenges and trying to innovate to come up with ways to help their organizations be more sustainable. So today, we have a really interesting discussion planned for you all. We're joined by Nick Stefanese at Northwell Direct. Hello, Nick. I'll give you a chance to say a few words in a second, but just a really interesting discussion because Northwell Direct is part of Northwell Health. And they're doing something very interesting. They are essentially trying to go upstream and go into the payer space, create a direct relationship between a health system and a provider organization and employers in their market. This is probably the most ambitious of strategies that health systems undertake in our various efforts to be more sustainable in our market. So we're really excited to talk about what the experience has been that Nick has been through, and that what his organization has seen and what it took to get here, and what's next for them. Nick has been in this role for a little while, but it's important, I think, to know that before he sat in this leadership seat at Northwell Direct, he also sat in various leadership positions inside of Northwell Health. So very interesting for him to have an insider perspective of the sort of inner workings of a health system before trying to package that up and innovate around it to offer something direct to his market's employers. So I'm really looking forward to this conversation. Nick will share a little bit about their effort first, and then we'll just have a dialogue. And I've got lots and lots of questions to ask. So we'll jump right in. How are you, Nick?
I'm doing well. Thanks, Sasha. How are you?
No complaints here. Thank you very much for joining us. You and I, we talk about this issue all the time. I think it's sort of top of mind for a lot of health systems around the country. Everyone's interested, but there are probably lots of reasons that a health system can think of to not do this. So that's probably what has me most excited about hearing from you today.
I appreciate that. And let me just start by thanking you and the team at Revive, not only for inviting me here today to share a little bit of our perspective and our experience on launching a direct-to-employer business in the market, but also to you and Revive for championing this kind of thinking and really being a thought partner to health systems around the country as we think about how do we navigate what I think we all recognize are incredibly complex and challenging dynamics that will likely only continue to get more and more complex and challenging. And I believe direct-to-employer strategies have an important role to play in helping organizations navigate those challenges and that evolution. And so I'm just grateful that you and the team at Revive are similarly, championing those ideas and partnering with health systems to think that through around the country. I'll start just giving you a little bit of my background, and then I'll talk a little bit about, and really this is more just for context setting than anything else. I think the much more interesting part of the conversation will be when we can actually get into a dialogue here. But just by way of background, I've served for the last 3.5 years, really since we launched the business, as the CEO of Northwell Direct. I have spent my entire career in the healthcare industry, And really, I think about that career in sort of two phases. The first phase, as Sasha sort of pointed out, was really spent within the four walls of the not-for-profit delivery system in progressive leadership roles across technology, operations, in particular operations within the ambulatory space, and then human resources across the enterprise. And then made a pivot for the second half of the career thus far. And I've spent that primarily working in the venture space within the healthcare ecosystem, primarily through health system and private equity sponsored ventures. And so I've had the privilege for the last 3.5 years serving as the CEO of Northwell Direct. And it's been the fastest 3.5 years of my career. And I think some of the most impactful and some with, I believe, the greatest potential over the long term to have an impact on where at least our organization is going and how we see the market evolving. But why did we get into this? How did we get here? How did we make the decision to get into this direct to employer business? I think if you flip to the next slide, our recognition was that things are just at a kind of unsustainable place. For too long, if we think about the cost of healthcare and how that cost is borne by the true payers in the healthcare ecosystem, the employers who provide access to coverage and health insurance coverage to more than 160 million Americans. For too long, the trend lines have been moving in the wrong direction on cost. And every year, the double-digit increase comes in, and every year, the CHRO and the CFO, have to have that debate about how much of that increase is going to be absorbed by the business and how much of it is going to need to be passed on to their team members. And I think the reality is, here on the other side of the COVID pandemic, dealing with all of the challenges we have recruiting and retaining talent, with all of the inflationary and other financial pressures that our organizations, that our employer organizations are all facing. The reality is everybody is clamoring for something different. And there is more and more recognition that the same old solution is not going to work. And it was this realization, both as the largest healthcare provider in the state of New York, as well as the largest private employer who grapples with those challenges ourselves, that really opened our eyes to the opportunity to offer a solution that not only could be strategically advantageous to the health system, but that also could have a really significant impact for the employers, unions, and their employees that live in the communities that we serve. And that really was the kind of genesis of why we made the decision to launch Northwell Direct. And if you flip to the next slide, just to give you a better sense of what is Northwell Direct. We are a wholly owned subsidiary of the health system that operates autonomously day to day, governed by a board of directors that I sit on with 8 other senior executives from Northwell, chaired by the president and chief operating officer of the health system, to provide the appropriate oversight and governance. But at its core, a wholly owned, autonomously operated subsidiary that is focused on partnering with employers to provide good quality care at a lower, more sustainable price point. And the way that we've done that is through a really broad, diverse range of offerings that we've made available to employers. And that includes a high-performing network that we offer to self-funded employers as an alternative to the traditional insurance carriers and the traditional insurance models for their team member benefits. And it also includes a range of clinical services that we offer in the office or virtually. Certainly over the last number of years, virtually has become a more and more important focus. And that includes everything from the traditional occupational health and medicine type services to some more innovative approaches to direct primary care, behavioral health, and virtual care solutions. And what you see across the bottom, this is just a subset of the clients that we've worked with. Really, since we've launched, we've worked with over 150 local, regional, and national employers across the full portfolio of services that we're able to offer. That includes about 100,000 members who use the Northwell Direct network as their employer-sponsored healthcare coverage. And that also includes a broad range of employers from the NYPD to the US State Department, Bank of America, Whole Food, and others that have adopted some of our clinical point solutions to address unique needs. So that's a little bit about what we are and what we do with the employers. But I wanted to also share, if you flip to the next slide, this is not our first foray into this space. It is not our first foray in acting on our thesis that there's value in being closer to the true payers of care, payers for care. And the reality is we've twice tried. I highlight our most recent case study before Northwell Direct to be an insurance company. And we launched in 2014 an insurance company based on this exact thesis that focused primarily on the small group and individual market, and that by most objective business measures was incredibly successful. Grew to over 150,000 members very quickly, high levels of customer satisfaction and retention. But unfortunately, due to some provisions of the Affordable Care Act, primarily around risk adjustment, that business lost through risk adjuster payments about $500 million, which as a health system, parent company that is a not-for-profit organization was just unsustainable. And so ultimately that business folded, and we spent a number of years thinking about how do we get back into that space? How do we activate against that thesis in a different way to position ourselves for success? And that really is what guided us into the employer space, the self-funded employer space in particular, and how we, in addition to getting back into the space and activating against that thesis, could be a solution to those challenges that I outlined earlier. And so we launched in 2020. We are serving the New York metro area today, but we view this very much as a long-term strategy. And I believe there's an opportunity for like-minded provider organizations around the country. And we've already proven we can do this locally. We've brought other provider organizations that are not Northwell into the network that we make available to employers. I see no reason why we can't scale that model across the country, that provider organizations can't link arms and say, we are ready to offer an alternative together to the traditional insurance carriers that will reduce costs and improve quality for the members served in these employer-sponsored health plans. And that's our long-term strategy and why we're so excited about talking to other potentially like-minded health systems. If you flip to the next slide, number of the ways that we're working with employers, the strategies that we're deploying really ground to these 6 pillars that you see here: improving affordability, increasing access to high quality, high value care, helping the individuals that are leveraging our solutions better navigate what we all know is an incredibly complicated healthcare ecosystem, fostering integration and coordination, sustaining profitability and for the health system, and ensuring sustainability for the employer clients that we serve. And most important, and I'm glad we ended on this one, really enabling and continue to center and focus on that relationship between patient and provider, and doing all that we can to nurture it and guide it over time. And that's really where we'll be focused. In addition to growing geographically in the reach and the impact, these are really the strategies that we'll be focused on as an organization. And then, as I said, you can see on this last slide, we've worked with over 150 employers since we've launched. You can see on the next slide that they are really an incredibly diverse range of employers: large, small, public, private, for-profit, not-for-profit. To me, what it speaks to is the breadth of the opportunity. The fact that employers of all shapes and sizes are open to new solutions, and that if we can be creative and collaborative together, we have an opportunity to have a truly transformational impact on how care is organized, delivered, and paid for in this country. Because again, 160 million people across the country have access to health insurance through an employer-sponsored plan. The potential here is significant. We believe that it is a core part of our strategy. And I look forward to talking more about our experience and answering your questions as we get into it.
Well, thank you for going through that. I think it's a great setup for a real discussion. I'd love to pick up where you just left off, which was that sort of logo page of employers that you're working with. I was racking my brain trying to figure out what's the through line for all of those organizations, because I see police departments, sports teams, Amazon, and it's really a wide array of employer organizations. Is there something they share in common in terms of ambition or operations or anything? What is it that they're looking for that makes them answer the call in terms of what you're offering?
Yeah, to me, the most common thing, most common theme that I pick up across those employers, excuse me, I'm going to apologize to the audience because they're probably going to hear me cough quite a bit. I'm in week 3 of bronchitis, feeling better, but I apologize in advance if you start hearing me hack throughout this. But the most common thread that I see across those employers, Sasha, is that they really care about their people. They really want to be able to continue to invest and do the right thing by their employers by their employees who they know work really hard for them, enable them to do the important work that they do every day as an organization, and whom, need access to good quality care. They want to be able to invest. They want to be able to support those people in the right way. But they're in this position where they're having to balance that against financial realities and a financial reality that is getting harder and harder to navigate every year. And so, a lot of them are at this point where they're throwing their hands up in the air and saying, there's got to be a better way. There's got to be a way we can balance being good financial stewards of the organization with our desire to invest in and take care of our people. And that really sets the stage for an incredibly engaging, productive conversation about the potential.
I mean, I think that the way you summarized it is really useful for me, right? The growing sort of tension or desperation to keep this sustainable from the employer's perspective creates a very large opportunity and good potential for us. It's sort of a logical thing to recognize, but it takes a lot of sort of ambition and risk tolerance to be able to jump into it, especially for an organization like yours. You've tried this a couple of times and it hasn't necessarily gone the way you've wanted it to. Can you talk a little bit about what it took this time around to get buy-in, to build some sort of consensus around the table at the leadership level to say, okay, this is the strategy that we're going to pursue and we're going to be committed to?
Yeah, and I'll sanitize the responses from some of the colorful language that was included. But there was, when this concept, this notion of let's find a way to re-enter the insurance space, even though we're not offering a fully insured product, even though we're not a licensed insurance entity, but this idea that we would even want to play again in the insurance space. There were many people around the organization that said, you've got to be kidding me, or are you crazy? Or we've got all these other competing priorities. We've got a capital budget that's already, as an organization, almost $1.5 billion annually. We've got to convert to Epic. We've got to do all these other, things. How can you possibly, after the experience, want to talk about getting back into the insurance space? I think a couple of things really helped us to overcome that. First is, and it's probably the hardest, but the first is just culture. Northwell has a culture that is steeped in a rich history of innovation, that is steeped in a rich history of doing what sometimes feels against the conventional wisdom, or what the wise people across industry would tell us to do, or in market would tell us to do. And a firm belief that we have to innovate our way out of the financial pressures that we as an organization experience, namely declining reimbursements, changes in reimbursement mix that we are seeing accelerate, frankly, that in order to put ourselves on sustainable footing long term, we really needed to innovate our way out of the problem. We needed to diversify our revenue streams so that we could navigate through this. And so, I think we had that sort of cultural foundation that helped. Once people got over the initial kind of shock of, you're really talking about this, that leaning into and embracing that culture that we've always had as an organization really helped. I think getting out and talking to employers, bringing employers in to talk to the C-suite at Northwell really helped them to see the extent of the opportunity. It's one thing to look at numbers on the page, but to bring these employers in and have them share their perspective, their needs, their challenges, was also incredibly helpful. And then, we spent a lot of time focusing on, how do we do this in a way? How do we balance the need to be fast moving, to be nimble, to be responsive as a commercial entity, without putting ourselves in a position where the organization that we build could get too far ahead out on our skis, create too much risk for the organization too quickly. And so we settled on, yes, we want to incubate this entity out of the health system, but we want to wrap it with the appropriate governance and oversight, with a true board of the senior most executives from the health system, so that there was a comfort level that it had the right control. And not only that they were then vested in making sure that the organization they were betting on had what it needed in terms of buy-in, support, and resourcing around the organization to be successful. So I think those couple of things, Sasha, were really, really important as we helped people move through the process about thinking about this and getting to yes on getting back into this space.
Yeah, I appreciate you sharing all of that. I know that for a lot of innovation efforts, that's probably the hardest step for our industry, is just getting ourselves aligned internally to the point where we can actually step in and say yes and do it. And it sounds like you all have gone through that process in a really responsible way. Can you talk a little bit about your sort of investment horizon? How committed is the organization to this? How far out are you looking? And how do you make sure that people don't sort of lower their eyes and think shorter term if it's not going swimmingly in this month or this quarter?
Yeah, great question. And this one is really important. One of the things we said early was that if we did this, we didn't want to collectively as an organization look at it as a short-term bet, that we were going to make this an investment that was a long-term strategy to support the health system in its evolution long-term. And so, we've built a business plan that has supported investment in building out all of the infrastructure that's going to be needed to sustain this as a long-term play. So we've got now over 30 people that are dedicated just to the Northwell Direct business and growing it commercially, servicing the members, and making sure that the experience we provide to the employers we support is reflective of that quality brand reputation that the health system has built. And so I think that recognition, that acceptance, that commitment up front that this was long-term, that we were going to invest in building it the right way, was really important. because it's really easy year to year in the budget cycle for an organization to say, oh my gosh, we've got a budget gap of X, Y, or Z, and do what they normally do, which is everybody's got to contribute. And believe me, we want to be part of the solution. But we constantly ground in that experience everybody back to, guys, remember, this is what we said. It was a long-term play. This is a build. This is for the future. And so that has been really helpful. The other thing that has really mattered has been top-down demonstration of leadership commitment. Michael Dowling, who is our incredible CEO of the health system, has made absolutely clear this is a top 5 priority for him personally, and that his expectation is that everyone in the organization finds a way to say yes and support the work that we're doing at Northwell Direct. And it's not just been words, it's actions big and small. So, you know, we've presented over the last 3.5 years, probably 5 times to his board of trustees. And when you think about a health system with 5,000 employed providers, 850 ambulatory sites, 23 hospitals, you know, a massive corporate enterprise, you know, all of that competing for airtime with his board of trustees, the fact that in 3.5 years, we've been given a significant amount of airtime, it reinforces the point. And so it's actions in addition to words that, from an organizational commitment perspective, has been really, really helpful. Relationships also matter. You know, I've been with the organization for 15 years. And so, you know, number one, I know exactly how much risk tolerance we have as an organization, exactly where that line is, and how far we can push our toe over it. And we know who to call around the organization when we need help trying to troubleshoot through something, and that matters. So I think, you know, those couple of things are really important. To us, this is a 10-year play. This is a 10-year strategy that we are building toward. And we're really clear, and we communicate that often and sort of on repeat to anybody that'll listen. So those are the couple of things, Sasha, that come to mind on that one.
Right. I think the fact that you're really familiar with the organization, you've spent enough time sort of inside of it to know it, and to know its risk tolerance. I mentioned that at the outset because I think it's a really important part of how you succeed here, is by knowing sort of on the intuition side, not just the facts and figures side.
Yeah, and look, I'll be candid with you, Sasha. I mean, I'm not in this seat because I am the foremost expert in this country on all things managed care or reimbursement or insurance. We've brought in really smart people with those skill sets that have, really helped us to build what I think is a stellar leadership team for Northwell Direct. But the reality is, I think they asked me to step into this seat. One, because I had a track record in the organization of delivering results, building businesses on their behalf. But secondary to that, because I know the organization. And I would push it as far as I possibly could, as fast as I possibly could, without getting too far outside the realm of what the organization was ready for, comfortable with, and felt appropriate, given those past experiences that were, pretty recent past. So I think that's a really important point. Again, back to setting up a structure that got everybody to a place of feeling comfortable.
Right. So I'll sort of continue my line of questioning around issues that make this not make sense for our audience. And another one, and I have this conversation all the time with clients and friends in the industry, which is, they're health system X is getting into the direct to employer business. That might work because their market is unique. Ours isn't. I'd love for you to talk about your market. New York is a really competitive market, both on the provider side and especially on the insurer side. I'd love for you to talk a little bit about what makes your market unique, not in terms of advantaging you, but maybe in ways that you have to overcome that might be disadvantages based on the nature of the market.
Yeah, New York excuse me, Metro New York is a really interesting market, hyper fragmented, hyper competitive. Every borough and county is unique and quite different. And people that live, 5 or 10 miles in a straight line from a location, aren't necessarily traveling to receive care if it involves getting on a bridge or crossing a river. So it is a really interesting, really unique market. I think our early recognition was, look, we're the biggest health system in the state of New York, certainly in the New York metro area. We've got a geographic reach that covers 4 of the 5 boroughs of New York City, covers Long Island well up into Westchester. But even being the biggest, our footprint alone wasn't going to be enough to allow employers based in New York Metro, some employers based on Long Island. It wasn't going to be big enough, sufficient enough for them to say, we're comfortable making this kind of transition, moving into a high performance network solution for our team member benefits. And so, our belief was, well, then let's go find some like-minded provider organizations. Let's go find some people that maybe we used to think about as competitors in the traditional sense, but in this new approach might actually be great collaborators. And so we've approached and we've brought in other provider organizations into our network, including Maimonides, Montefiore, RWJ Barnabas in northern New Jersey, Garnett up in Sullivan and Orange counties. We're pushing into Connecticut, starting to push into Pennsylvania. And we found a real receptivity because I think more and more what the provider organizations that we interact with see is there's an opportunity here. There's an opportunity not only to do right by the employers in their individual markets, but there's an opportunity to get proactive in setting a strategy that deals with what they see on the payer side, with the way the payers are getting into the provider space and seeking to redirect care based on their interests. And so we've found a lot of receptivity in other provider organizations, but it had to start, Sasha, with that recognition that this is sometimes an uncommon characteristic of health systems, like to actually sit back and say, we know we can't do this on our own. We have to have partners to do this the right way and to have a meaningful impact. I think starting from that place really allowed us to go out and build the right relationships to set this thing up to be successful.
That's such an important point that, again, from sort of an industry's perspective, it's another reason why we wouldn't choose to go in this direction, right? Network deficiency from our perspective. So for an organization as large as yours, with the footprint that Northwell Health has, to think, hey, ours isn't enough. Let's go build bridges with other providers and really provide the network that we think would be really viable for an employer. I think that's a really important message to send out, that it's possible, and that you found not just some takers, but some really willing and excited partners in other providers that you might otherwise think of as competitors. Yeah.
It's been a really encouraging part of the journey, for sure.
Very cool. So let's talk a little bit about how you sort of go to market around this. We talked a little bit about the employer logos that you shared earlier. What's your message to them? How are you targeting them? How does that go?
Yeah, so it's a couple of important decision points that we made. Number one, even though we're not a licensed insurance entity, we have made sure that all of the individuals that we have brought in to build out our sales infrastructure are licensed to sell insurance. If for nothing else other than we know how important benefit plans are, insurance is in the employer-employee relationship. We wanted to be respectful of that. We wanted to make sure we were doing the utmost to care for it in the work that we were doing. And so we've built a team in our growth organization that is incredibly experienced in the benefit space, really, really talented, and with deep broker relationships. It is really, really important to be respectful of the relationship that exists between employers and their brokers, and to not create a situation where a broker in any way feels like you're trying to disintermediate them from the relationship with their employer client. That was something we decided philosophically early on was going to be a red line for us. We just wouldn't do it. And in my view, look, I'm selling something to the employer. I'm selling them something that I think really can be a strategic asset and really help them on a number of different fronts. But let's be honest, I'm selling them something. And it was kind of my belief that all else aside, they deserve any objective third-party counsel that they think is appropriate as they're making the decision, let alone accounting for the complexity of benefits and these decisions. But they deserve whatever counsel they think is appropriate. And so we made a really clear decision. We were going to be really respectful of that relationship, and we were going to really proactively go through the broker channels as a means to get to the employers. Now, that is not to say that we don't market directly to heads of HR, heads of finance in the employer market in generally, and we'll take a meeting. But if we have a conversation, and particularly on the work that we do in the insurance space, if we have a conversation and it looks like it's going to get serious, our first recommendation is we need to bring your broker into this conversation if it's a conversation that started as a result of our direct to employer marketing efforts. So, I think the talent with the right skill sets and experience and the right relationships in the broker community, really important. Commitment to maintaining and nurturing the broker and employer relationships, and then casting a wide enough net between the brokers and the employers has been really important. And then the other thing I'd kind of say, benefits and insurance tend to be an area where a lot of perception and a lot of notions can get introduced to the conversation and into the decision process. Well, if we move to a narrow network, our employees are going to lose something. We're going to disrupt their, the care that they've received historically. They're going to lose access to the doctors. What we try to do is take the perception and take that noise off the table and really lean into what does the data tell us? What does the disruption analysis tell us? What does the utilization tell us? What are the savings opportunities showing in a very concrete, data-driven way? And let's have the conversation from that starting point versus, perception that may exist for whatever reason. And that's been really effective. And candidly, Sasha, what we see time and time again when we look at the data specific to an employer is they're paying for a whole lot of choice that their employees are not using or taking advantage of. And that really changes the dynamic in the conversation with an employer when you can show them that in a data-driven way.
Yeah, that's pretty fantastic. I think this is something that payers count on a lot, right? But you're asking an employer to make a change in what they're accustomed to, and the bar for that is pretty high. So it's interesting to hear how you're going about helping them sort of become more tolerant of creating that change. internally. I'd love to hear a little bit more about what the market response has been to your message, both from employers, but also from brokers who are probably also just used to selling the sort of same set of traditional offerings to their clients.
Yeah. So, look, we've grown really fast. We've got over 100,000 members that are using the network for their employer-sponsored health plan. We're really proud of that. And we take really seriously our commitment to those individuals. And we fully expect that those numbers will continue to grow year over year. We're really excited about the potential. So on the one hand, we've had great success early as we've launched the product. By the way, our own team members utilize the Northwell Direct network for their team member benefit. And we felt like it was important to demonstrate to the market how much we believed in this solution, that we were willing to use it for our own employees to great success, by the way, both in terms of clinical outcomes, in terms of savings, and in terms of increased utilization of the network and team member experience. So we felt like that was important, but we've had we've built a lot of great momentum in the market. I would say from a broker perspective, even an employer sometimes, if there's one thing that we're having to overcome, it's a newness factor, right? It's a new product in a space that is complicated and that is personal to each and every one of the members that carry the card of their employer-sponsored plan. And so it's kind of an interesting dichotomy, because on the one hand, they're hungry for new solutions, open to new solutions because of the challenges they're experiencing, but there is a weariness about, this is new, is it proven? And I believe that the only answer to that is time, and we're committed to this long term. Our own people use it, and so we'll demonstrate. We've got the early adopters who have jumped on board. It's going really well for them, and we'll continue to tell those stories out into the market. So that's one thing that we've had to overcome despite the momentum that we've built. And then, there is the perception challenge again of, narrow networks are, we're going to lose something. Our employees are going to perceive this as a takeaway. And I think there, more than anything, education, the data I talked about, and then education really helps, because, we have solutions to most of the things people would be concerned about. So just take disruption. Well, I'm worried, if we just move to this narrow network, people will be concerned about disruption or losing access. Well, guess what? We can put a tiered network structure in place. We can wrap our high-performing network with one of the BUCA networks. So now your employees don't lose anything. There's no disruption. But when they make the choice, if we do benefit design the right way, when they make the choice to use providers and hospitals and facilities that are in the high-performing network that we've put in, they'll save and you'll save. And that's a great way to drive behavior change, when you can create that win-win between the employer provider by putting a solution like this. So anyway, to make the point, the perception challenge is another one, but to us, it's just, well, let's go through it point by point. Let's either use data or look at what solutions we have to address the specific concerns.
So you've talked a little bit about performance. I think you've got your own interests, you've got the patient's interests, and you've got the employer's interest. Can you talk about performance so far from those three perspectives? How's it going? How do all the constituents in this experiment feel about how it's going?
Yeah, I think, it's been really positive. Certainly I can speak to our own team member experience, but also that of our other customers at a team member level. It's been incredibly well received, because I think once people get over that initial reaction of, oh my gosh, HR is announcing this new thing, they realize that, like, the reality is not a heck of a lot is going to change or be disrupted for them. And then we provide we really focus on customer service and how to make sure that the experience is as seamless as possible for them. And we give them tools and resources through our care management programming that I think they find really, really beneficial. So from a team member perspective, it's been really well received. The results have been positive. I think the employer clients that we have seen, by the way, we have 100% retention rate at this point of our customers that have joined. They've at worst in their renewals, because most of the clients that we have using the network, most of them as self-funded employers carry stop loss insurance, reinsurance. We have, in the worst case, seen a flat renewal on stop loss year over year for those that are using the network. Most have saved when they've come up for renewal because of how the network has performed. And so from a financial perspective, our clients are performing quite well. And, those factors line up to make the brokers happy because they've taken a risk recommending a new solution. And what we're seeing, it's delivered, and we're starting to see more. It's interesting. Our early sales were actually across a pretty diverse range of brokers. It wasn't like one broker brought us 20 cases and those were all that we placed. We actually worked with a pretty diverse range of brokerages and brokers. And now we're starting to see, now that we've gotten through first and second renewal, we're starting to see same store sales through those broker channels. So to me, those are like the really positive indicators that we're onto something, that the trend lines are going to continue to move in the right direction.
That's pretty fantastic. I love the sort of same store sales analogy. How do payers feel about all of this? Obviously, as a provider organization, you're still dealing with all the traditional payers in your market. They must have something to say.
That is the most frequent question I get when I go out and talk about this. And it usually comes from a place of a lot of concern. Concern that if a provider organization goes down this road, that the insurance carriers are going to react very negatively, that they're going to end up, in the worst case, out of network, and that this is going to have catastrophic financial impact. And I think our experience, and let me start by how we approached it. Our thought process when we launched this and when we got ready to launch it was, those things could happen. Those things could. It is possible that the payers would have that kind of reaction. Did we think it was entirely likely? No. Did we think it was highly likely? No. Because the reality is, in the environment that we're in the way that our ecosystem is structured, we need one another. They need us just as much as we need them. And so it was our belief that we needed to go in prepared for the fact that they could react in a very negative way, but we were not going to let somebody else's reaction be the determining factor in what we did strategically to chart the course forward for our health system. Our belief was this is an important lever for revenue diversification. This is an important lever to prepare for the continued transition to value-based care and taking risk. This was an important overall growth lever for the health system, and that we needed to be committed to it and deal with whatever came our way in terms of reaction. And so there was a lot of discussion about that. Like, I don't mean to downplay it in any way. We had a lot of discussion about it, but it was just our belief that we need to chart what we believed was the right strategy. Now, what has the reaction been in practice? What I would suggest to you is we have seen the full range of reactions. Everything from, geez, how'd that work out for you guys the last time you played in the insurance space? Good luck. To, how dare you? This is our space. How dare you? Try to encroach on what has been our traditional business model. which, by the way, is kind of funny when you think about the fact that all they're doing is encroaching on what is our traditional business model, but I'll set that logical disconnect aside. And then, we've also had payers that have responded and said, you know what, we get it. And, we're willing to, partner, and we're willing to be part of the solution that can allow us to find a way to win together. And that's illustrated by no better point than the fact that, we are able to wrap our high performing network with access to BUCA national networks. And so we've seen every flavor of reaction, regardless of what we get from them. We ground ourselves in our belief that this is the right strategy for the organization. We're seeing the right momentum, and that, more than anything, is validating that we've made the right decision. And then the other thing I would just note, and it's an important one, we've set up some pretty clear firewalls between us and the managed care side of the not-for-profit delivery system. And so while strategically those things were considered, as we've launched and as we've operationalized, those two sets of considerations are separated. And in fact, the managed care department of the health system views me as a payer, just as they view all of the BUCAs as payers. And so, we go through contract and rate negotiations just the same as the others. And I think that is an important feature. And I think it is reflective of the fact, again, that this was an important overall strategy for the health system. It wasn't just a managed care strategy.
That's very interesting. And speaking of, there are a couple of questions in the Q&A. One sort of relates to this issue. I'll ask those, and then I'd love to end with a particular question. So hopefully we'll have time. The first question is, where do the savings come from? Are the provider and facility fees with Northwell and other partners like Montefiore better than through the traditional insurance carriers?
Yeah, so there's sort of three ways that we're seeing the savings. The first is, yes, we have negotiated discounted, advantageous rates with the provider organizations that have joined our network. The reality is that's the price of admission to this thing. If it's going to be successful, we've got to have the rate differential in the market that is going to attract employers to this. The belief that we have, and that the others have, and that we're starting to see, is that rate discount will be offset by incremental volume that will move through the participating systems by virtue of benefit design and other aspects of what we do with these employers when we implement, and that the keepage within the system is also incredibly important. But that's certainly one of the big drivers. Secondary to that, the savings come through stop loss. We have cultivated a panel of stop loss carriers that have rated the power of the network and that are willing to get very aggressive and advantageous in their pricing for policy. And we see that be a significant driver of savings. And then third, and this is a longer term play, the impact that we can have through the care management solutions, adoption for which is much higher than the carrier-based solutions. And we're actually able to get much further upstream because we can trigger action right at the bedside, right in the provider office, versus waiting for a claim to come through to get these individuals engaged. But we're seeing, I mean, just in our diabetic population alone, that is enrolled in our care management program for diabetes, $100 PMPM cost savings. I mean, those dollars are real. And again, that to me is the longer range play through this, actually keeping people better. But those are kind of the three levers that we see that help to drive the cost savings for these employers.
Yeah, and sort of going back to the second lever that you talked about, your stop loss partners. There's a second question in the Q&A. Do you have a specific reinsurance carrier, or do you use multiple depending on who the broker or TPA brings in? And do you mind sharing what reinsurers you've had success with in your market?
Yeah. So we have a panel of, I think it's 5 or 6. Don't hold me to that number. And we can get the names as a follow-up. But we have a panel of 5 or 6 that we've built a relationship with, that we've spent a lot of time educating, not only on the network and the structure of the discounts, but also that we've then demonstrated the results to. That as a result of that work are willing to provide aggressive rates for any of our prospects. We will typically go to all of those individuals, all of those organizations when we are looking at a prospect, and we try to find the best quote for that specific employer and their specific population. However, we also, if the broker has a preference or the broker wants to market and place the stop loss, we also allow for that while providing insight into what our stop loss partners are quoting. But again, just trying to be respectful of the fact that many of those brokers have their own relationships. We will not disintermediate that in any way. We try to find ways to work within those parameters, if that makes sense. It's really collaborative and transparent with the broker, with the employer. We don't, there's no behind the scenes maneuvering. It is all transparent as we walk through the process.
Yes, that's fantastic. Just, I know we've got a few minutes left, and I get to ask the question I've been waiting for, which is, what advice do you give to people that are sitting in your seat or close to your seat in health systems across the country that, like me, are asking themselves all the questions for why not to do this? What's your advice to them?
Yeah, I think my number one piece of advice would just be find somewhere to start. Find somewhere to start. Maybe you don't feel like your organization is ready from a network perspective, and your market, isn't yet open to the kind of collaboration that we described, such that you could get into the, self-insured employer space from a network perspective. Fine. Then find a way on the occupational health and medicine side to do a new hire screening, or to do a wellness event, or if you don't want to go full network, create a surgical bundle or a center of excellence, something that your health system is really, really good, because we're all really, really good at something. Find something that you're really, really good at and offer it as an adjunct to, an augmentation to their existing benefit plan. Don't look at this as a space where you've got to be everything to everyone all at once. Find ways to build, toward being a truly comprehensive solution by piloting and getting started. So that would be, I think, Sasha, my number one piece of advice. My second piece of advice, talk to employers, find out what they want in your market, start there. And again, that could help you find the one place to start. And then 3, spend the time with your internal stakeholders to build the coalition, build the support, build the buy-in, find out what they'd be concerned about, and think through how to mitigate those concerns, because you're going to need the relationship, you're going to need the partners. So you asked me for 1, I gave you my number 1, and then two bonus.
And we get bonuses. Love it. Love it. Hey, Nick, I just want to say thank you. We're right at time, but thank you so much for spending this hour with us. And thank you for being an innovator. Right? You're out there sort of on the front lines, figuring out how we can be more sustainable as provider organizations. And I think everybody owes you and your organization a debt of gratitude for figuring this stuff out, so that we can all be second movers right behind you and learn from what you're experiencing out there. I really appreciate that you've spent some time with us today.
Well, look, Sasha, I'm appreciative of you saying that, and really thankful of the opportunity. And look, we've done a lot. We're not perfect, and we don't have it all figured out too. So I come into this fully recognizing that we have opportunity to learn. So I am happy to spend more time with anybody that wants to talk direct to employer, share our perspective, but I'm sure there's a couple of things we could learn from some of the amazing organizations that are represented on the call here today. So really appreciative to you as well, Sasha. As I said at the beginning, not just for the opportunity, but also for the work that you guys are doing to help our like-minded health systems and providers around the country think through these types of strategies. Thank you.
Yeah, thank you. And hopefully everyone who's on the line and has been part of this discussion will join us again at our next one, which will be Tuesday, December 12th. That's going to be a really interesting conversation, a little bit different. We'll be joined by Stuart Kilpin and Bob Beverwick, who are managed care leaders at Trinity Health, which is one of the country's largest nonprofit health systems. We'll talk a little bit about how they have helped their organization flip the script on payer negotiations and really carry a much more transparent, much more always on message to employers, to brokers, to their community about the what's at stake. What are the financial realities that health systems are facing? So that should be a really interesting conversation. I'm very proud of the work that Stuart and Bob are leading for Trinity Health. Can't wait for that conversation. Thank you very much again, Nick, and thank you everyone for joining, and we'll see you next time. Take care.